As students return to school, COVID hospitalizations are once again on the rise. In fact, new data from the CDC shows hospitalizations increased 19% last week. Former White House COVID advisor Dr. Deborah Birx is urging Americans to take the virus seriously, noting that hospital admissions for COVID never reached zero. She is also calling for a more updated booster to combat the latest variant.
We're in a current wave, and I know everybody out there knows someone who has COVID right now, and those are the ones that happen to test.
U.S. health officials say the new updated COVID booster shot should be available in mid-September. President Biden is also requesting additional funding so the new vaccine can be widely available. But what are the trends here in Iowa when it comes to COVID-19? Local 5's Mary Sugden checked in with surrounding health systems and joins us with what they want you to understand.
Yes, Stephanie, the message from local health systems is to not panic. Just like every other illness like the flu or RSV, COVID-19 will likely have seasonal swings like what we're seeing right now where the virus infects more people. But the good news, since that initial outbreak, we have the tools and knowledge to navigate these spikes.
There have been increase in cases of COVID-19 in these past month.
Mercy One's Dr. Anissa Afroz says while COVID cases may be rising, this won't be a return to 2020 statistics.
Definitely nothing as we had before. This little increase, and we, call it viral increases like these happen during seasons. I mean, we see that with RSV, with influenza.
Unity Point is also seeing an uptick in cases. Here are the numbers for August. As you can see, as of this Monday, there were 17 COVID-19 patients, more than double what doctors were treating the previous week. Dr. Afroz says typically there's a trend in those who need the hospital's help once they're infected.
Iowa DHS reported that 79% of the people in the hospital across Iowa have been unvaccinated, and definitely that's what we see in our hospital too.
For anyone who's immunocompromised, Dr. Afroz says the vaccine and other preventative steps, like wearing a mask in a crowded public space, are crucial in keeping you out of the hospital.
It's a respiratory virus. You do not know who is sick and who is not sick and who is carrying the virus, who's shedding the virus.
For all of us, doctors recommend listening to your body. If you feel sick, take an at-home test. And if it's positive, make sure you don't pass it on to family and friends.
You may think it's a simple allergy, but get yourself tested. And if you test, you isolate yourself. You stay at home at least the first 5 days when you are more likely to infect people.
So what about boosters? Well, Dr. Afroz says there's really no clear answer for everyone on when their next one should be, so a good idea to talk with your own doctor on this. But generally, if it's been 6 months or more since your last vaccine or booster, Dr. Afroz says you should get one this fall, especially if you're 40 years or older.